that this virus spreads? Because that understanding is critical for people to understand whether a mask is required or not required. Because a colleague of mine also has this question on whether healthy people showing absolutely no symptoms or do not have an immediate risk, should they be wearing a mask and going to their workplace? Should children be wearing a mask and going to appear for their CBSE exams? So if you can give us a clear understanding of how the spread happens, then probably people will get a better understanding on the importance of wearing a mask.
The last question first. Sure, Afrida, so the last question first. In case of healthy individuals who do not have symptoms, it is very clear that the current advisory says you do not need to use the mask.
Okay.
Now, as far as the transmission of this virus is concerned, this happens by droplet infection. So if an individual is coughing, then the droplet spray which comes out, that is what is transmitting the virus. Typically, this cough is whenever an individual coughs, you get a droplet spray up to 3 to 4 feet.
Okay.
So what is recommended right now is if anybody is symptomatic at home or at work, you must maintain at least a distance of 4 feet. Of course, if somebody makes a violent cough, it can go further than 4 feet as well. The second thing is about the hygiene I mentioned. It's really important to use either the sanitizer or soap and water. So sanitizers may not be easily available everywhere, but soap and water is the way to go. So frequent cleaning of hands with soap and water is extremely important, or using sanitizers. The sanitizers should have about 60% alcohol content at least within those sanitizers. There are myths about spraying alcohol on the body and spraying some oils on the body, etc. I think those do not hold true at all.
Right.
Now, as far as symptomatic patients are concerned, they are the individuals who should use the mask. Now, there are two types of masks which are available. One is the standard surgical mask, which may not be so helpful, and the other ones are the N95 masks, which are the ones which actually would filter the virus. So it's very important that the individuals who are having the symptoms of any flu-like illness should preferably be using the N95 mask, so when they are coughing, they are not spreading the infection to other people. It's now the question is, who should be using the masks? The mask should be used surely by the healthcare professionals. The mask should surely be used by individuals who are in contact with somebody who has a flu-like symptom. The mask should surely be used by individuals or caretakers of sick people. So these are some of the common indications where I would say that the mask use is required.
Right. So unless you are in an affected country or unless you're moving in a space with mass gathering, would you say, Dr. Sajid, that wearing a mask without symptoms, or you're not a healthcare, you're not a caretaker of a sick person, is not necessary?
See, that's a bit tricky, in case now if you're in a gathering, if you're in a crowded place, it's very difficult to know, who is infected and who's not, who's got symptoms and who's not got symptoms. So that becomes a tricky situation. So the current advisory which is given is to avoid going into gatherings unless it is absolutely necessary. What the results or what the data are currently showing is that individuals who are elderly, more than 50 years, who have comorbid conditions, who are already sick, are at a higher risk of contracting the coronavirus. And in these individuals, these individuals may have slightly more severe symptoms than the other individuals. So I think it's no clear answer on that. But I think if somebody is going to a crowded area, it's really difficult to ask people not to wear a mask and go. But the standard care would be to avoid going to gatherings unless it is absolutely mandatory.